Hello, I'm Dr. Mani Akkineni, specialist in regenerative and integrative medicine at Akkineni hospitals. Wishing you good health. Today's session will cover key concepts. Stay with us and take notes.
Imagine a 58-year-old entrepreneur at the height of his career. He exercises, he's socially active, and his medical labs always come back normal. But standing in his office, he is deeply, inexplicably exhausted. He is quietly dealing with a web of invisible symptoms. His energy drops sharply. His sleep is erratic. He pushes through mental fog, and joint stiffness makes his regular workouts harder to recover from. His test results say he is fine, but his body is telling him something entirely different. His situation highlights a stark reality of modern healthcare. Our medical systems are exceptionally engineered for survival. We are incredibly good at keeping people alive, but we struggle to keep them functional. This graph illustrates the problem. The top line represents lifespan. We wait until a catastrophic event occurs to step in with heroic measures. But look at the health span curve below it. For decades before that sudden drop, actual quality of life often erodes. When those unmanaged, everyday symptoms flare up, the standard approach treats them in isolation. We prescribe medication to force a few hours of sleep, or use painkillers to quiet aching knees. These treatments mask the symptoms, but they leave the underlying biological wear and tear untouched. Waiting for the machinery to break down leaves millions of adults trapped in a state of mere survival. To actually thrive as we age, we must rethink exactly when we begin treating the body. This proactive scientific model is focused on health span. Instead of waiting for a formal diagnosis, researchers are now identifying and intervening in biological decline decades before a disease ever takes hold. To do that, we have to look at the microscopic level. External signs of aging, like gray hair or wrinkles, are just lagging indicators. The real structural decline happens deep inside our biology. Notice how this healthy cell accumulates internal, glowing debris. This represents cellular senescence, cells that refuse to die, and mitochondrial breakdown. Over time, these microscopic glitches quietly multiply, setting the biological foundation for chronic conditions like cardiovascular disease. The fuel required to maintain and repair these cells comes from our metabolism. When insulin resistance or fatty liver disease disrupts that energy supply, the cells lose their ability to clear that debris, and biological aging accelerates. This makes metabolic health the most accurate early warning system we have for the aging process. Monitoring and optimizing that metabolic foundation is how we intercept the clock. By correcting metabolism early, we can slow down cellular damage before irreversible disease sets in. Leading institutions like Akkineni hospitals are directly combating this cellular breakdown by adopting two specific forward-thinking clinical disciplines. The first is regenerative medicine. Rather than relying on chemicals to numb a problem, this field asks how we can actively stimulate the body's innate ability to repair and restore its own tissue. It utilizes advanced physical rehabilitation alongside targeted cellular health therapies like platelet-rich plasma or PRP to physically rebuild biological function instead of just suppressing pain signals. The second discipline is integrated medicine. Notice how this central node, fatigue, is tethered directly to sleep, stress hormones, and metabolism. Every pulsing line shows cause and effect. A patient's lack of energy doesn't happen in a vacuum. It's deeply tied to these interconnected systems. If a doctor only treats the fatigue, the rest of the web pulls the patient back toward illness. True longevity requires repairing that entire interconnected system simultaneously. Longevity science prioritizes the maintenance of functional independence over the pursuit of immortality or miracle cures. It requires a rigorous focus on a few specific biological areas. The first area is physical. Preserving muscle mass and functional mobility is one of the strongest predictors of independence in older adults. Once pain stops a person from moving, the body rapidly loses metabolism and enters a cycle of decline. The second area is mental. Longevity is deeply tied to emotional resilience. High psychological stress, elevated cortisol levels, and even social isolation cause a measurable physical increase in inflammation throughout the body. Because genetics and lifestyle vary wildly, everyone ages differently. We have to map out a personalized strategy, measuring specific biomarkers like hormonal balance and sleep quality to catch risks while they are still modifiable. The future of medicine requires us to stop waiting for illness to arrive. By pivoting from a reactive model that simply delays death to a proactive one that actively preserves vitality, we finally achieve the true objective.